Hello, everyone. It's so good to see you. Happy Friday, buen dia, and we're just so excited to kick off this weekend with you. So thank you so much for taking the time. I'm so excited to go ahead and kick us off for today's webinar. Today's webinar actually serves two purposes. It is both the kickoff for the LUCHAR Initiative, and it is also a webinar focused on storytelling from the Latino community. So just to say a little bit about myself, my name is Paulina Sosa. I am the moderator for today's session, and I'm also the founder CEO for Latinx Voices. So again, it is my pleasure to be here with you all. So as you can see here, we are excited to continue celebrating Latinx Heritage Month because yes, even though it stopped October 15th, the celebration of our stories, of our comunidad, of everything that we are working for the future continues on throughout the rest of this year and into next year and so on. And so I'm excited to be joined by Kristen, Liz, and Krista from Marked by COVID and Project Pulso. So you can see them here. And I'll be sharing a little more about them, and they'll have some really exciting presentations, stories, and updates on their work for us here in a little bit. But just a few housekeeping items. I do want to say a quick shout out to Alejandra and Clarissa, also from the Latinx Voices team. They are on the chat with you all. So if you have any technical questions, if you have any questions for the speakers as we go through the content, type those in. We want to be able to hear from you. We want this to be an engaging session. And also, I'll go ahead and say that we'd love to hear a little more from you. So if we want to go ahead and also respond to this brief poll we have here, or if you'd prefer to just type in the chat where you're calling in from, we'd love to see all the different voices we have on the meeting today. So thank you all so much again for being here. And I'll go ahead and just get us started with our content. So just really quickly, who is the Latinx Task Force? What does the task force do? The task force really is focused on addressing health disparities and gaps in the Latino community around the United States. And so we do this through education, partnership with local, state, national partners, many of which I'm sure are on the call with us today, and of course, community. We cannot do this in collaboration without our promotores. We cannot do this in collaboration without our community members, our families. And so we are excited to do what we do in collaboration with you. So what is LUCHAR Health? You see this big sign behind me saying LUCHAR. You've heard us reference this. You saw it in the registration description. What is LUCHAR? And so it stands for Leading and Uniting Comunidades through Health Awareness and Resources. And so this initiative is really brought to you by the coalition of the task force. The coalition is 300 partners strong, again, all the way from California to Florida to New York. So we have a range of organizational voices, of community leaders, promotores that are contributing to the work and to the effort of the LUCHAR Initiative. And actually, just looking really quickly here from the poll, we see many of you have answered. It looks like we have a lot of health professionals here. But it's great to see that we also have some students and some of you here from just a personal capacity or a storyteller capacity. So it's great to see you all virtually. And just moving us to the next slide. So how is storytelling tied into this big health initiative? What does storytelling, what do stories have to do with a health initiative at a national scale? And so really stories are at the foundation of how we even started this initiative and how we even decided to move forward with it. So many of you saw reference to the Latinx Boost Up Tour, the national tour we did in collaboration with Health and Human Services, the Juntos Si Podemos tour back in the middle of the COVID-19 pandemic. And I know many of us are trying to forget those days, the COVID-19 pandemic days. It was rough, it was hard. But one thing that stands out about the Latino community is the amount of resilience and collaboration our community had to do to not only get through it, but to rise above it. And so what we did in the middle of this tour, we went through 25 cities around the country, many of which I'm sure are represented here today. We went through Miami, we went through, I know Miami for sure is represented on the call right now with Liz. We went through parts of Texas, San Antonio, all the way to Lubbock and Amarillo in the Panhandle. We went through Arizona, we went through California, and of course we were up in DC and New York. And so we were really all over the place. But one thing that we were really adamant about doing in this tour was listening to the community, because I'm not from Miami. I don't know what the unique differences, the unique cultural vibrance of the Miami neighborhoods are, but those in Miami do. I don't know what the unique differences in Lubbock are, but those in the community do. And so we made it a very important point to develop key partnerships and hear directly from those community partners, to listen to communities and to community organizations, promotores, and to listen to community members, listen to families, have pláticas con cafecito y pan dulce, and just sit and talk and hear from you about what the pandemic was like for you and your loved ones. And so those stories are exactly how we came up with the LUCHAR Initiative. And so as you can see, I'm not going to go through the stories, but we have this little video. And then we also had a video testimonial that we did through the pandemic. I'm going to show you 10 seconds. So this is just an example of some of the types of stories we got. This was a family member out in the Fort Worth community. And so we just wanted to hear stories across the board. So as you can see, stories were the foundation. We went through 25 cities, had 250 meetings and events. 7.5 million people were reached through this. And that's just an estimate. There's no real way to fully know the number. And we got over 200 stories. And actually, I'm happy to say that the number of stories is continuing to go strong. So again, I want to pull back a little, because you don't want to hear from me this whole time. You want to hear from the speakers. And so I'm going to go ahead and first start by just giving you some introductions before passing the floor. So we have Kristen Urquiza, who's the co-founder Marked by COVID. So Kristen is the nation's top disaster equity advocate. I mean, it's amazing seeing all the work that Marked by COVID has done, with expertise in race, economic, environmental, and health policy, an experienced grassroots organizer, and she'll share here shortly the different types of events that they've been able to organize. Urquiza co-founded Marked by COVID and catalyzed the nation's foremost community-led COVID justice movement days after the death of her father, Mark Urquiza, to COVID in June 2020. And I know that that is also a big central part of her story and of what she'll be sharing with us today. So the way that she's uplifted voices, and her team have uplifted the voices of families and just anyone in the country who's been affected by COVID. So we'll be hearing from her shortly. We also have Liz Rebecca Alarcon, who's the founder of Project Pulso. And Liz is a media entrepreneur and political analyst with expertise in Latin America and US Latinos. Liz's writing and commentary have been featured in the New York Times, The Atlantic, MSNBC, Time Magazine, and Miami Herald. And Liz is also a Fulbright Scholar to Costa Rica and an alum of University of Miami. Any University of Miami alums here in the chat? If you are, raise your hand or just, put it in the chat. And so as you can see, Liz's passion, for the Latino community really comes through the work that Project Pulso has done and continues to do. And I'm sure there are many of you that already know Project Pulso. I've been a big follower of Project Pulso really for the last several years. And so we're so excited to hear from Liz about how Project Pulso is embracing the power of storytelling in the Latino community. And then last but definitely not least, we're excited to have Krista Villeda, Chief of Staff of Project Pulso. And she's going to be sharing her story about how COVID-19 affected her and her family. And so it's going to be an amazing example to hear from her about that. But prior to joining Pulso, Krista worked as a strategy and operations consultant to tech, media, and telecom infrastructure companies in the US and South America. And she is a proud Salvadoran and Guatemalan, born and raised in LA, and has lived in DC since 2012. So I don't know if there's any others in the call that are also proud Salvadorans or Guatemalans, but it's so great to have you. And again, that's part of what we do, right? We embrace our Latinidad in the midst of our story. And so we're so excited to be hearing from Krista here in a second. And so with that, let's go ahead and dive in, right? We want to hear from the speakers. I want to hear from the speakers. So I'm actually going to go ahead and pass the floor to Kristen, the co-founder of Marked by COVID, and let us hear a little more about what Marked by COVID is doing and how you can join the work. So Kristen, the floor is yours.
Thank you, Paulina, for that amazing introduction. And I'm so excited to be here with everyone today. Thank you so much to you and Alejandra for putting this together, and everyone else at the task force, and to my other colleagues at Project Pulso who'll be chatting. I am just so grateful for your leadership and all that you do, and to Krista for sharing your story. As Paulina shared, I too have a COVID-19 story that is not unlike many of us in the Latino community, in that I lost a parent to COVID. One thing I don't talk often about is that after my dad died before the end of 2020, I lost 4 other relatives in my family. The year of 2020 was like none other for me and many of us, as we took phone call after phone call about loved ones getting sick, loved ones not being able to get access to care or treatment, and unfortunately folks dying. So I'm going to spend my time today talking about the work that we do at Marked by COVID and how we are harnessing the stories from the community impacted by COVID, in particular Latinos, to ensure that not only do we attempt to find some sort of healing from this horrific tragedy, but that we also put in place policies that ensure that our loved ones' deaths were not in vain, and that the next time something like this happens, that we are not flat-footed as we were when this started. And I'd like to begin with just sharing this quote from President-elect Joe Biden on the eve of his inauguration. He held the only national COVID remembrance that's happened from an elected official on the steps of the Lincoln Memorial overlooking the reflecting pool. And part of his remarks included this line, "To heal, we must remember." And I wanted to share this because remembering is about telling stories. And I know, probably like many of you, I grew up having stories from my abuelos about their time in Mexico and coming to the US, and really creating the framework of the entire community that I grew up in was all about stories about our recent past, as well as where we came from, and sort of our hopes and dreams for the future. The sad thing is that we have lost so many people to COVID, and I want to set the context here about our stories, and that we've lost now. These numbers are out of date because we're no longer tracking COVID deaths. We estimate it's around 1.2 million people that we've lost from COVID, but it's hard to know exactly. And the truth is that, COVID is still not over. We are still experiencing a surge of cases, of people passing, and as time goes on, we're kind of normalizing COVID infections as we hope that vaccines and other treatments stave off death. But the reality is, especially for the folks who are most vulnerable amongst us, COVID remains a real threat to people's health, as well as the possibility of contracting long COVID. To put this in perspective, over the course of the 40 years since HIV/AIDS, another horrific pandemic, has hit the US, we lost 400,000 people, or 700,000 people, excuse me, in those 40 years. So in the course of 2 years for COVID, we lost over 1 million people, compared to 40 years of HIV/AIDS, 700,000 people. This gives you an idea of just the order of magnitude of loss that we've endured. And something that's really, I think, important to this conversation is that the CDC itself estimates that about a third of all COVID deaths were in Latinos. Just to remind us, from the 2020 census, Latinos make up about 19% of the population. So the impact is by far disproportionate. And there has been a lot of good research that's come out that said this has had a huge impact on our life expectancy. Latinos have lost 4.4 years of life expectancy versus 2.4 years for our white counterparts. So this is a really huge issue for us. And so we believe that telling our stories is a really important part to combat this massive forgetting. And I'm sharing with you a slide that shows a totally different disaster that had a completely different reaction from society. 9/11 unfortunately took about 3,000 US lives on that deadly day. As a result of 9/11, we launched a war for multiple decades. We completely transformed government. We created an entirely new department. And I mean, to this day, millions of people go through TSA and take off their shoes in order to help keep one another safe. And part of the thing that we've seen with COVID is that even though this has been the deadliest disease in American history, we really don't have any unifying visual to really propel that robust policy reform forward. So part of what Marked by COVID is doing is helping to share our stories in a variety of different ways to be able to not only provide that healing, but to also ensure that something like this doesn't happen again. For the most part, that visual doesn't exist because of the nature of the losses themselves. Many of us suffered in isolation, forced to say goodbye over the internet. And this is one of the last conversations that I had with my dad while he was ventilated in the ICU in Phoenix of June of 2020, just a couple of weeks after the state of Arizona reopened, and the governor and the president at that time saying, it's okay, if you're not sick, if you're not an old person, you're going to be fine. Well, he wasn't fine. He was otherwise healthy, 65-year-old who by no stretch of the imagination thought he was a viejo. His parents lived into their 90s. Why would he be at higher risk of death and disease? You'll see that this Google Doc I have in the background is notes that I had collected from my familia to share with him so that he could be reminded about everyone who would be there had we been able to go inside the hospital. But unfortunately, like way too many, he died alone with just a nurse holding his hand. So we have been helping others share their story. And here's a picture of so many people that we've lost from COVID. Marked by COVID is now the nation's largest movement for COVID justice and remembrance, founded by and led by people who have lost loved ones to COVID. And many of you might be familiar with my story because I had the incredible privilege of sharing it before the nation and the world with the 2020 Democratic National Convention, where I talked about losing my dad and also the need for us to really focus on bringing people into elected office who believed in science and believed that this was real and that it was severely impacting our communities across the country, and in particular, our Latino communities. Part of what inspired me to speak up in the first place, and I'll just share this, I am an introvert and I'm very shy, but what propelled me to come above and rise above and find courage was that while I knew what was happening to my family was a tragedy, I knew it wasn't unique. At the time my dad got sick, our neighborhood in Arizona was the worst neighborhood in the entire world for COVID-19. It is no surprise probably to anybody on that call that our neighborhood is an 80% Latino, mostly immigrant community. I knew that the people in the hospital looked like my dad, looked like my best friend's dad, and didn't look necessarily like other folks that I had through education, the privilege to get to meet and work with. And so it was really important to me in this kind of context of this summer of 2020, where we were talking about racial justice, for us to also put rubber to the road when it came to health justice, that the people who were getting disproportionately sick and dying from COVID were Black and Brown and Indigenous. We've gone on to do a whole sort of storytelling across the country to help raise attention to these impacts and ensure that our loved ones are not forgotten, and policies are put into place to protect ourselves going forward. One of the first actions that we did was in conjunction with Dia de los Muertos in 2020, where at the state capitol in Arizona, we had a chair out for every loved one that had been lost at the time to COVID. And coming around the building was an incredibly breathtaking scene. From there, we have worked with hundreds of families across the country to do different types of expressions of grief and storytelling around their cultural moments. So Dia de los Muertos is important to us in the Latino community, but we're also looking and have partnered with folks in the Black community and the Indigenous community to do similar types of remembrances to really draw attention to what those communities have gone through and give people the opportunity to share their story and to humanize these losses, to put faces to names to these losses. The really big thing that I'm here to share about when it comes to storytelling is our work to establish a national COVID memorial. Over the course of 2020 and 2021, as I was acutely going through my own grief, we worked to host hundreds of focus groups where we talked to literally thousands of people who were going through COVID loss to help us think through, what do we want? How do we want to remember this? Because we know that this will be remembered one way or another. And history has a way of remembering things that really downplay the impact on Black and Brown communities. I'm trying to be very politically correct right now. It's infuriating to me that we continue to undermine the incredible contributions of our community to not only this culture and society we have now, but historically of the land that we're talking from. And so I wanted to make sure that COVID grievers, and then particularly Black and Brown ones, were put in the driver's seat. So we've been working to not only establish a COVID memorial, but a COVID Memorial Day to be observed on the first Monday of March. And the thing that we learned, which I'm not surprised of, is that people wanted to make sure that their loved ones, their faces, their names, the dates that they were here, and something about them was preserved. And a lot of folks brought up the idea of looking at Maya Lin's Vietnam War Memorial as an example of sort of something that kind of rose to the occasion of really humanizing losses. And we did the math to figure out what would it take to have a wall that just had everybody's name on it. And we realized that that was impossible. It would take wrapping the National Mall in the US 52 times to have enough space for everyone. So we knew we needed to have something that had augmented reality in it so that we could ensure that we had space for everyone. So we're coupling physical spaces with this augmented reality lens to be able to create an experience that really humanizes the losses within the context of the actual particular physical space that we're in. This is just one example of someone in our community that we lost from COVID. Genevieve Martinez was a nurse in El Paso. We all know how horrible El Paso was hit from COVID. And her daughter, Caitlin, shares, "We deserve an apology. We deserve to be heard. It never ends. It feels like new losses every single day, new grief, new hurt." And so some of these remembrances and stories are about the loss itself. Others are about just who the person is. But the thing that I love so much about this is that it is our own stories and our own voice without the filter of somebody with more privilege having to edit us. And so we are working with Snapchat, who has donated very generously technology for us to be able to bring this memorial to life. This is just still of the image of the memorial coming to life around the Washington Monument in DC with my dad being featured. And these stories, as I kind of come to a conclusion, are also helping to change policy. You're seeing here Susana Lechuga's husband, Ro, testimonial, not a day doesn't go by that we try to fill the empty spot that COVID has claimed by sending you to heaven. Your life was too short, but I'll fight your fight for you. And Susanna is one of our activists in California who helped us pass the first of its kind Hope account policy here in Sacramento. And these Hope accounts provide a small child savings account for each COVID child who's been orphaned or lost a caretaker to COVID. We don't talk about this often enough in when we talk about COVID, but we know that there are at least 350,000 children who have lost a parent or caretaker to COVID. And so we have been working with these kids all across the country and here in California and their, surviving family or caretakers to share their stories to ensure that there is financial stability for them into the future. Because I know had this pandemic happened 20 years ago, that kid would have been me. I wouldn't have gone to college. I wouldn't have gone to graduate school if somebody wasn't looking out for me to ensure that there was some sort of financial stability to support the collapse of losing a breadwinner in the family. And these are just a couple of the folks, kids here in California that, and sharing their story with lawmakers here in California helped make that policy possible. So in conclusion, we're working for permanent memorials. We're coupling with folks all over the country to be able to have these spaces together where we can continue to share our stories, continue to make sure that this pandemic is not whitewashed as the time that we were all over Zoom or couldn't find toilet paper, but the time in which we lost over 1 million people in our country and that their lives mattered and that in their legacy, their stories, they were not able to complete their stories, and as a testament to their legacy, that we resolve to do better by them to ensure that our children and grandchildren are better protected for whatever public health crisis comes along. And so I'm excited to share that New Mexico has secured a land grant for a COVID memorial, and we're talking to them about how to make that a space that ensures that these legacies are not forgotten. So I'm so excited to be here with you all and really appreciate, again, the space and time to share just a little bit of our work, and excited for the conversation that comes.
Amazing. Thank you so much, Kristen. And I feel like there was a lot of what you were sharing that really resonated with so much of us, so many of us. And so we really appreciate, one, you sharing your story, but two, also sharing how many of us on the call can share our story and remember how this affected our loved ones. And so speaking of personal stories from the pandemic, I'm going to now pass the floor to Krista from Project Pulso to share with us her story and to share how she was able to use a platform like Project Pulso to really get her story out to remember her loved ones as well. So Krista, the floor is yours.
Thanks, Paulina, and thanks for having me. I want to say also thank you, Kristen, for sharing your story. I think that your story really highlights the importance of storytelling and sharing first-person stories to folks. That's definitely what we have tried to do at Pulso throughout this pandemic. And I'll just start off by saying that on a personal note, COVID was really impactful because I'm a chronically ill person. I'm part of the Latino community, which was heavily impacted by this pandemic, as we all know, and we've talked about today. And also because I work at Pulso, which is a media outlet. And so we are a Latino team creating content for Latinos. We are the folks that we are creating content for. And so something that we asked ourselves a lot during this time was, what kind of content do we need to make for our audience? What would make someone trust us? How would our friends and family respond to this? How would I respond to the information that we're sharing? So one of the ways that we did that was by creating some first-person content. So we were testing on TikTok and on Instagram at the time. And one of the ways that we did this was creating videos showing ourselves getting vaccinated. So as you know, at the time, there was a lot of myths out there and a lot of rumors and things going around about COVID vaccines. And so we attempted to address that and provide information by filming ourselves. So me and another staff member, we filmed ourselves getting vaccinated, tried to be really honest about what the impacts of that were, how I felt afterwards, my perspective as a chronically ill person with a transplant. And so that was one way that we tried to provide information that our audience could trust. So not, saying there's nothing scary about this, or I don't feel anything, but also saying, hey, we went out there, we did this is what's happening, this is how it was, really showing the process. And so I think that that's just one example of how providing this first person content is really, really important. Other things that we did were providing what we like to call cinco en corto. So there were like weekly updates that we were sending our audience with, here are 5 things that are happening this week. Here are 5 myths that we want to dispel. And finally, the one story I wanted to share with you all was that I, at the time, did a story with the LA Times about vaccinating my family. So I'm sure you all can relate to how difficult it was during that time, especially early 2021, when the vaccines first rolled out, to get our families vaccinated. My family was definitely part of that. And so as a first gen Latina, as the only person in my family to have a lot of computer knowledge, I'll say, and first college graduate, all of that, the responsibility fell on me to get my family vaccinated, and it wasn't necessarily an easy thing. And on top of that, I was dealing with, how is the pandemic going to affect me? I have a kidney transplant. I don't think I left my house for 2 months, from like March until June. Maybe that's more than 2 months. And so it was like I was trying to keep myself alive, essentially, and was worried about that, while also being responsible for my family and for getting them to be vaccinated. So from DC, I was coordinating appointments in LA and making sure that, my uncles were taking my grandma to get vaccinated, helping folks get appointments. I'm sure many of you can relate to literally sitting on the floor with your computers, like refreshing and refreshing and refreshing, trying to find appointments for you or your family members. And that's what I was doing as well. And then, similar to our audience, I also had to dispel some rumors in my family. I had a difficult conversation with my father at the time, who was really skeptical of getting vaccinated and was really concerned about some of the effects. So part of the content that I was creating for Pulso was obviously for our audience, but it also helped my own family get a little bit more on board and comfortable with vaccination. I think, there's the element of I have a transplant. And so at the end of the day, it was, hey, like, I need you all to really try to do this for me. Like, if we want to spend time together, if you want to see me, this is something that's not negotiable for me. So different ways that we can go about this, but I just want to echo that I think a lot of the content that we share at Pulso just really resonates with our own experiences as a team. I see a question in the chat about how do you get through to elderly Latinos who are deeply religious. I have to share that I personally didn't have that experience in my own family. My grandma was probably the other person in my family who was really on board with getting vaccinated. And so it was actually sort of the Gen X folks in my family who I had to convince more than the elderly. I think sometimes there's a lot of I think often there is resistance from elderly folks in our family, but I think a lot of the time also elderly folks in our family are the ones who are willing to sort of do this work and convince everybody else. So those are my 2 cents on that, and I'm sure we'll keep talking about that in the Q&A portion, but that's how things went down in my family, at least. I think the other thing we need to talk about is how Latinos were disproportionately impacted. So, as I mentioned before, I have a kidney transplant. I was dealing with all of that at the same time. I think that what that leads to for me is the question of accessible healthcare. So before the pandemic started, I, had to go in person to doctor's appointments and get seen every couple of months. I am followed by doctors closely. And the first question that came up after this pandemic happened is, how do I get to all my doctor's appointments? How do I get seen by folks? Like, what about my medicine? Like, do I go to the pharmacy? Is that safe? Can I get my blood draws? Like, I don't know if that's safe. So, as we all know, Latinos are disproportionately impacted in terms of healthcare. We've heard from our audience time and time again that they suffer from a lot of different health conditions. We know that our communities are some of the most vulnerable. And so I think eventually we've seen a lot of solutions roll out that I think is one of the few sort of positive outcomes of COVID, which is now that more of us have access to things like telehealth appointments. Things have been delivered, like medications. A lot more things are accessible that way. And I hope that they continue to stay that way in the future. And I want to say that despite everything I'm sharing, this is not to say that informing or sharing our experiences with our community is easy. There's a lot of resistance to talking about COVID. There's a lot of resistance to vaccination. We saw at Pulso that a lot of the different content that we tried, it just didn't perform well with our audience. There was still a lot of myths going around, or folks would question, like, did you really get vaccinated? Or it just wasn't received as well as we'd hoped. So failing things out is something that we love to talk about at Pulso. We aim to inform our audience of issues that are impacting our community, and we will keep trying different formats, different ways to connect with folks, because ultimately we want to connect with our audience in the ways that resonate with them. And so even though one approach doesn't work with COVID, I think something that's important for us to remember overall as we talk about our families and our friends is that we have to keep trying to reach folks in different ways and let go of what's not working and sort of come back to the drawing board and keep testing things out. I'll say that from our surveys and feedback and questions that we prompt our audience with on Instagram and other platforms, we know that health and healthcare is a really important topic for Latinos. We've seen that time and time again from our audience. Folks have a lot of things to share about their experiences with healthcare. A lot of them not so great and negative. And I think that that's definitely been highlighted even more during this pandemic. So there is a lot that Latinos as a whole have to say about healthcare. And I think that highlights why some of this work that we're highlighting here today is really important. So yeah, I think that's most of what I have to share. I will say that I so appreciate hearing all the ways that different folks were impacted. I think that one of the other ways I'll mention is family. So we've heard people here talk about family. Kristen shared her family, and this week I've heard in other spaces people talk about how Latinos are unified by the concept of family. And I think that was one of the biggest impacts of the pandemic as well. I personally didn't lose any family members to COVID, but my grandfather died right at the beginning of the pandemic of Parkinson's. And because I live here in DC and my family is in LA, I wasn't able to go to the funeral. I didn't see my family for a year. And I live here. And I think that those are also really big impacts that perhaps we still haven't finished talking about as a community, just how like our social fabric was also really impacted by COVID, whether within our families or like with our friends. And that's probably one of the biggest ways that I felt the impact, aside from stressing out about my transplant.
Thank you so much, Krista, for sharing. And it looks like really your story and you sharing how some of the methods that you all had to do outreach for Latinos in Project Pulso really catered to some of the questions that many of our audience has. So thank you so much for sharing on your personal side. We just really appreciate and embrace that you're just willing to be open with us. But I also just want to make a call out to those on the chat that if you also have a story you'd like to share, we do have some ways to share. And so Alejandra with Latinx will go ahead and plug those links in, because that's what we're here for. We're here to hear each other's stories. And so I'm excited to pass the floor now to Liz, the founder of Project Pulso. She's going to share some exciting work, just kind of a continuation of what Krista started sharing, some of the exciting work at Project Pulso. So Liz, the floor is yours.
Thank you, Paulina, and thank you, Krista. I guess you could say Krista's like our very own promotora, right? Sharing her story and talking about her firsthand experience. This is going to be very interactive. If you all have your phones out, I want you to take them with you. And if you can follow along with what I'll be sharing on Instagram, you'll be able to see what I'm sharing too. So that way you can live a day in the life of Pulso with me as I'm sharing. So I'll start with Krista's stories. If you go to our Reels tab at Project Pulso, you can see her first video that she was talking about there. That's when she's getting her first vaccine. And then if you scroll up, you'll see her up here too with her second dose. So this is just a little bit of what we do with these first person stories about our day in the life experience. But if you go to Pulso, you are going to see the history that you didn't learn in school. You're going to see Latino pride stories about our culture and our impact. You might see some stories that are gonna make you mad about the injustices Latinos have been faced, which Paulina and Krista touched on in terms of COVID. And you'll also see some commentary on current events, on things that are happening and trends within our community. Before I tell you more, I want to answer to Sylvia with a story myself. So there was a gentleman who went to church and he asked el padre, Señor, priest, padre, por favor, ask God to please let me win the lottery. And the priest was like, okay. The gentleman comes back the next day and he's like, so, priest, padre, did you ask God to help me win the lottery? And the priest was like, okay, yeah, sure, I'll ask. He comes back a third time and he says, priest, so did you ask? Please put this intention, be my intermediary. Please ask if I am able to win the lottery. Tell him, please help me win the lottery. And then the priest comes back and says, God told me what to do. I asked him for you, and this is what he said. God told me to tell you, go buy a lottery ticket. So you will probably remember that story much more than stats and statistics about the impact of a certain issue, right? That's a silly way to address this issue of the religious resistance to getting the vaccine, right? Ese término in Spanish of ayúdame y yo te ayudaré, that many of our family might resonate with. Maybe using that story in a silly way to bring some lighthearted humor about the issues that our community is facing is how we try to address some issues that are happening within our community, whether it be health, whether it be civil rights, whether it be other issues in our community. So again, I give you that silly anecdote to let you all know on the call that you all have personal stories and you have lived experiences, and you can use humor and pride and emotion and details about a specific person's experience to illustrate a broader point. And I think that's why storytelling is so important. A fable, a myth, an anecdote, a funny thing that happened to you is so powerful to get a point across of like, hey, you know, the article that we see here in the chat, Pope Francis wants you to do this. yeah, why don't you connect the article about Pope Francis and the importance of getting vaccinated with the myth of the gentleman that asked the priest to help him win the lotto? You'll probably connect with folks who are resistant in a way that is much more palatable and is meeting people where they're at, which is something that we talk quite a bit about at Pulso. So I'm going to look through Instagram and show you all some stories that are really resonating with our audience, that really show the contrast of how something performs when we're talking about a broader trend versus how something performs when we are talking about a specific person's experience. And I think that that's a takeaway number one for you all. The micro story, the individual impacted details are universal, help you connect with something that will really resonate much more deeply with our audience. So take this story here, groundbreaking Latino inventions that changed the world. That's amazing, right? I already feel proud. This story got us maybe, a dozen shares. This story about a warrior that helped bring soldiers to victory and the specifics about how she did it and what happened to her on the battlefield. Like if you look through this story, you're going to read about how she even gave birth on the field. It was a Chilean Bolivian warrior. More than 2,000 shares. Both of those stories were prideful. But this was a listicle, right? You see a young woman at the top, but we're giving you a list of stories and inventions. And yes, we tell the story there, but it has more stats and figures, and we do personalize it, but of course, not as much as the emotion and the pride that you're hearing when you read the specific story of what this warrior experienced, right? Another example of something like that that I want to share with you all is we will sometimes share, again, trends here, very important work around LGBTQ community being discriminated against and how to stop that. Important story, commentary. We brought some personal examples into that, but if you scroll down, and feel free to share more examples that you all are seeing on Pulso around some stories that are resonating with you or any questions that you have about those. If you scroll down, you're going to see a story here about a trans Latina icon who is moving and shaping covers, who went from foster care to be a recognized actress. Many, many more comments and a more powerful story. So again, the idea of using a trend or an issue that folks are feeling and doing a micro story about it, personalizing it, doing as much as you can, sharing detail about that person's experience, it absolutely resonates. And I'm sharing with you all the culture and the history content that we do, but we've also done this with issues like reproductive rights, right? I know many of you here are healthcare workers. And we know that within our community, there was a misconception that Latinos were actually against reproductive health, reproductive rights, abortion rights. That's actually not the case. It is a somewhat controversial topic for some of the folks in our audience. But all of the polls show us back on the religious question here that Latinos may not decide to make that decision for themselves because of their deep faith, but they are not against that being a right that Latinos can access privately with their doctors, or something that they decide privately and take upon with their spiritual and religious leaders. That's an important distinction. And so for us, when we were trying to tackle that issue, I'm scrolling down to find a couple of stories that we shared, where we shared the specific story of a Latina in Texas who suffered very much by trying to access reproductive justice. And here's that story here, right? How much more powerful to illustrate an issue that's taboo. And we got many comments, right? You'll see that number 103 there, where you're seeing people give their opinion about all of the things. It's not that we shy away from differing opinions or from people showing their point of view, but again, her personal story is so much more powerful. So I leave you all with the power of story in your own communities. You all, your own lived experiences, what you're seeing in your community. Tell the story of Pedro or Juana or of Maria when you are trying to bring others into the cause. You know, I think we'll both leave here so touched by Krista's story, by Kristen's story. That's what you'll remember from this webinar. And I think we can change hearts and minds and bring people in to advocate for better health for our communities if we do more of that storytelling by and for us.
I love that so much, Liz. And I feel like you took the words out of my mouth just in talking about why our stories kind of taking it home, why not just COVID specific stories, but our personal story, the story of our Latinidad, the story of our cultura, all of that makes a huge difference, not only within ourselves, but as we talk to others about who we are and who we are as a community. So thank you so much for sharing some of those very interactive activities with us about Project Pulso. And definitely want to ask that everyone follow the links that Alejandra's been popping into the chat for Project Pulso for Marked by COVID. And I do want to say, I know that we are closing in on time. And so unfortunately, we won't be able to get to that the panel of questions that we had. But I feel like we did touch on some of the questions that were in the chat. But before we kind of go to closing remarks, I do just want to say, just want to ask everyone to please stay on with us. We still got a few more minutes to share some closing thoughts, and we also from the Latinx Task Force have some really exciting things coming up. And so one thing I'll also say is that if there is anyone on the call that would like to stay on just for an extra 5 minutes to ask a specific question to one of us, we can accommodate. But we will close the recording today at 4 Central, 5 Eastern. So really quickly, before we go to my closing slides for Latinx, I just want to ask Liz, Krista, Kristen, if you can share a quick 30 seconds, 1 minute closing remark that you'd like to leave the audience with before we close out today. Who'd like to kick us off?
I'm happy to jump in. Amazing panel, you all. I am just going to say, I think the top line from here and something that I think about all the time is that our stories are our superpower. So share it, and also agency. We should be allowed to share our own stories. We do not need intermediaries. So whether that's Marked by COVID or others, connecting with other Latinos to make sure that we are in charge of our stories because they're so powerful is my TLDR. Today.
Thanks, Kristen. I'll jump in to say that I think 2 things I want to leave you all with is that while we're talking to our community, and something that is really important to us at Pulso is not shaming folks. There's a lot of information that people just don't know. I know I talked about the burden of like helping my family through vaccination process while I was also trying to keep myself alive as a chronically ill person. But a lot of that has to do with just not knowing or not having access to, internet and appointments and how to do things. And so that's something that's really important to us in our work and the stories that we share. And I encourage us all to keep that in mind, no matter how frustrating it might be. And the last thing I'll say is just that the pandemic is not over. There are some of us who live our lives very much impacted by COVID all the time. I've, been to healthcare settings twice this week. And every time I think about it, like, I have to bring a mask. I have to bring a backup mask. I'm really scared. Like going to the hospital, going to a doctor's appointment for me means I'm exposed to a lot of things. And so just reminding us all that there's still a lot of us who think about this every single day. And so there are still stories to be shared.
Thank you, Paulina, for having us and for welcoming Pulso to this space. I just want to share some love to you all participating. Latinos are on the front line of the recovery economically and also on the healthcare front line of our country. And so just to know that we are among so many people in that space Your stories are just as valid as all of ours, and the experiences that you have had is something that we not only appreciate, but want to tell more of. And so I want to leave you with a point of pride, which is, remember that Latino history is US history. Your contributions, your lived experiences, what you do and contribute every single day is what is powering this country. So just thank you all for all that you do in all of your spaces.
Beautiful. I feel like y'all said everything I was gonna say anyway, so that was just so beautiful. And before I even do my closing slides, I just want to ask everyone on the call to give our speakers just a thank you applause for sharing with us and for giving us a platform to share our stories. And so speaking of platforms to share stories, I'm going to share my closing slides really quickly before we close out today. And so really, we do have a couple calls to action. As I mentioned, we do have our next webinar coming up next week. So today was the exciting kickoff focused on how the community and the stories of our community really are pushing forward the post-COVID health agenda for Latinos. And so next time, October 30th, we will be specifically talking about the LUCHAR Initiative and 3 specific topics. We're going to talk about worker health, infectious disease, or vaccine preventable disease. And so we will be talking about COVID, but we'll be talking about other infectious diseases as well. And we'll also be talking about border health. So we'd love to see you all there. Please share that with your colleagues. We also want to, just to echo what our speakers have shared, your story really does matter. And so we do have an opportunity for you to share your stories with us. We'd love to hear your stories. I know that there's a few of you that mentioned in the chat you have stories to share, and we'd love to hear that. And maybe there's a way that Project Pulso and Marked by COVID and all of us can come together to support you and your loved ones with your stories. So please share that with us. We also want to say that our LUCHAR Health Initiative website is live. So if you have a chance to just go to our website, check it out. It's an interactive website, and this is just the start. There are more topics to come. So feel free to just take a moment to peruse and read through. There's been a lot of work, a lot of love that's gone into this. And so we'll be continuing to share updates on this, of course. And then this is just a little draft, a shout out to one of our artist collaborators, Edward Dennis. He's working on our Lobito mascot. And so, this is an opportunity again for us to fight for our community and to really embrace what we are and who we are. And so this is an opportunity to, again, just support the LUCHAR Initiative. So this is a link to just share your support, whether it's from an organizational capacity or a personal capacity, to share your support and your love for the LUCHAR Health Initiative. We'd love to see you there. And if you are talking on behalf of an organization, we'll be reaching out about partnership and collaboration. As you can see, we're huge on partnership. And there are, of course, many different ways to engage with us. We will definitely share these slides over email because I know many of us have to run off, but I do want to share that this conversation does not end here with this webinar. It does not end here at this call. So with that being said, I just want to say thank you on behalf of the Latinx Task Force, on behalf of our team. I want to say a very heartfelt thank you to Liz, Krista, and Kristen for being here with us and sharing your stories, but also sharing ways for us to continue to be empowered, not only within our community, but on behalf of our community. And so with that, again, I just thank everyone for being here on a Friday afternoon, no less, to kick off this webinar with us, kick off this health initiative, and more importantly, to continue the celebration of Hispanic Latinx Heritage Month. Con eso, un gran gracias a todos ustedes. A big thank you to all of and each and every one of you. And we will be seeing you October 30th, I hope. So thank you so much again.